It looks like things are slowing down now a little bit in terms of people coming on, so we will go ahead and get started. Good afternoon. I'm Kathy Grinling. I'm the lead for the Collaboration Multidisciplinary Team Science part of the CTSA. Our function has been putting on Blue Sky groups for the last several years, and Blue Sky groups were conceived to help enhance collaboration across the CTSA institutions. And generally, they are a discussion between folks who have not collaborated together before, but have a general interest in a common topic. They're very unstructured, and usually we allow lots of time for discussion. Today is going to be just a little bit different because we need to first provide you with some information about the Cooperative Extension, which is a really rich resource that the University of Georgia offers that I hope you'll learn about today and think about how you can collaborate with the folks at the Cooperative Extension. With that, I'm going to turn it over to Allison Berg, who's convening this Blue Sky group today. She is an associate professor and extension nutrition and health specialist at UGA in the Department of Nutritional Sciences. Her research involves evaluating community extension education programs to improve nutrition behavior, and also looking at the implementation of evidence-based interventions through the cooperative extension model. So she is an expert in this area, and we're really pleased to welcome you here today. Allison?
Thank you so much, Dr. Greenland. Can everybody hear me okay? Great. Well, as Dr. Greenland said, my name is Allie Berg, and I'm an associate professor here in the Department of Nutritional Sciences at the University of Georgia. And I'm also an extension and nutrition and health specialist. And then I also get the pleasure of serving on the community engagement program for the Georgia CTSA. And one of the things that I was told when I first joined the community engagement program is that when University of Georgia was brought on to the Georgia CTSA, one of the most exciting things about that was this statewide footprint that we have. And cooperative extension is one of the ways in which UGA has that statewide footprint. So I'm excited to share a little bit about what we do and who we are with you today. And I have several of my friends and colleagues on here with me to talk about their extension and research and outreach programs, and hopefully spawn some conversation and some collaboration and future discussions. So I am going to start out with a little bit of education here, a little didactic, so bear with me. But I'd like to just share with you about the cooperative extension system if you are not aware. So in 1914, President Woodrow Wilson signed the Smith-Lever Act, creating the Cooperative Extension Service. And the idea was that through research translation at land-grant universities, cooperative extension would bring the university to the people. So it exists across the entire United States and territories. So we're in 50 states, 5 territories, and over 3,000 counties. And the idea was that the universities really shouldn't only be for the rich or for the students or for generating research that only other researchers read, but rather these resources and services should be brought back to the community to create a healthier and more productive state. And so with our programs and materials, we try to do just that. We try to bring research to the people. And you can see a quote here is, "It was designed to aid in diffusing among the people of the United States useful and practical information on subjects relating to agriculture and home economics, and to encourage the application of the same." And so we very much started out in agriculture, but also in the area of home economics, which has evolved more into what we call family and consumer sciences, but is health in the many ways that you think of health, not just physical health, but mental health, emotional health, spiritual health, financial health. And so one of the ways, for example, that cooperative extension has been utilized to bring this information to the people is the example of the COVID-19 pandemic and immunization education. CDC has actually funded cooperative extension by way of the Extension Foundation to do some immunization education. And our goal is to bring that education to the people, provide that research science-based information, and allow them to make informed decisions. And we say this here at UGA, that we translate the science of everyday living for families, farmers, and communities to foster a healthy and prosperous Georgia. And so what that looks like is really a cooperation at the state, and the national, the state, and the local level. And we do this work through cooperation between our state office and our county-based offices. And one of the most important parts of that is our extension agents. They serve as those local educators, the consultants. They are embedded in their communities. In the Georgia system, we are in one area, one of three areas, either agriculture and natural resources, 4-H and youth development, or family and consumer sciences, which is where most of us who are on the call today sit, is within family and consumer sciences. And so really, when you think about that statewide footprint, we have a presence in all 159 counties across the state through cooperative extension. Now, we may not have 1, 2, or 3 agents in every single county, but we have a presence there through some sort of staff or programming. And then these agents are supported by the specialists like myself and my colleagues who are on here today. And we provide content expertise and training to agents. We provide programs for them to deliver. And we also do our own research and program evaluation to inform those programs and the rest of our work. And so what this looks like is Extension does a lot of in-depth educational programming. We have series-based programs, workshops on a variety of topics, which many of my colleagues are going to talk about today. We also have like one-on-one interactions. One of my colleagues who can't present today, Joan Kuntz, she oversees a program called Virtual VITA, where we help individuals with their income tax preparation. And so that might be more one-on-one interaction, or some of our family and consumer sciences agents, they might have it where an individual comes in who's newly diagnosed with diabetes, and they have a meal plan from their doctor and dietitian, and they need some help in understanding those instructions. And so we do provide some of that one-on-one interaction. And then we also do lots of written extension materials, and then, social media and other virtual programs. And so when you think about the translational science spectrum, I mean, it's not a perfect example, but we are in sort of the bench to the bedside, but bedside to community, and community to, I think, curbside, as one of my colleagues called it. And then we often, filter information back up to academia, about what works in the community, why a particular treatment or program isn't working. And so these are just some examples of research that has occurred in many of the areas of ag and natural resources, 4-H and youth, and family and consumer sciences. And I'm not going to do too much in depth on this, but historically we've been known for our agricultural research, like testing soil applications, maybe helping farmers with certain pests, animal husbandry. But now we're getting more well known for the work that we do in health and wellness. And all of my colleagues on today touch that space very much in helping the whole person be healthier. And so today you're going to hear from several of us who are extension specialists. And like I said, we are responsible for program development in our particular content areas. We train our agents to be competent educators, so they come from a variety of backgrounds. And so, for example, in my area, if they're going to teach the diabetes prevention program, I have to get them trained up and ready to teach that program. We all evaluate our programs, and then most of us conduct research, whether that's a formal research appointment for our faculty line or not. And then we have lots of communication directly with the public through, newsletters, websites, media appearances, and so forth. And so I'd like to allow each of my colleagues a little bit of time to share with you about their work, and hopefully that will really get us ready for some rich discussion. So just to give you an idea, I'll start out. And my research and outreach projects have been in the area of nutrition and health for prevention and management of chronic disease. And so a lot of my work right now has to do with implementing the National Diabetes Program, diabetes prevention program through extension, and really exploring implementation of that program, understanding what are our barriers and facilitators, and the health outcomes of our participants. I also have some work that is funded by the CDC High Obesity Projects and the Robert Wood Johnson Foundation, in which we're utilizing community-based coalitions to address obesity and other health issues, where the community kind of decides the area that they want to work on and helps really address, policies, systems, and environment to improve their own community. I mentioned that we are involved in some immunization education. especially with particular groups. I'm a little bit more tangentially involved in that, but especially with migrant workers and trying to encourage them to get their COVID vaccinations. And then I have had some history of working with our cancer prevention educational programs, teaching people about breast, cervical, and colorectal cancer screening and nutrition and health behaviors for cancer prevention. And so for my future work, I'm looking for colleagues and opportunities to further explore the diabetes prevention program implementation. That's an evidence-based program, but when you take something from the clinic into the community, there are challenges that ensue. And so just interested in that program, its implementation, also its effect on the family. We're working on these community coalitions. I'd be interested in partnering with individuals on that. And then also anything related to our cancer prevention education with regard to screening and lifestyle behaviors. And so you're going to get a contact list if you haven't already received it from Lauren James that has each of our contact information in our webpage bio. So at the end of this, and I'll be happy to send out these slides as well so you can have everybody's information. So next up is Dr. Ted Futris. Ted, would you like to share about yourself?
Sure. Thank you, Allie. Let's see. All right. So I'm a family life extension specialist, which means I provide support to our family and consumer science agents, as well as to all of our 4-H agents across the state, and certain family life programs. Particularly, a lot of my work is focused on working with couples, both married and unmarried, as part of 2 back-to-back federal funded projects. So we're currently, our current project frameworks is from the Administration for Children and Families, Office of Family Assistance, and we're recruiting couples and delivering and evaluating a program that I developed called Elevate. That is that we're offering to couples both virtually and in person, and we're comparing the impact of the program on couples who participate in one or the other. And we're trying to include all couples across Georgia. In our last grant, we primarily targeted couples and single parents, actually, as well, that were involved in child welfare services. We had a lot of foster caregivers who participated, and so we're continuing to work with foster caregivers and families in child welfare. We're also, for this current round, really trying to engage first responders, given the elevated stress that they've experienced and tension on their relationships and families, as well as our military connected couples. I found, like, particularly with the virtual option, it's been really great to see some of our military couples participate where one might be deployed, and so the virtual context provides them an opportunity to engage and participate together in a program while they're apart. So there's more information available there if you go to elevatecouplesgeorgia.com and like to check that out. The other project that I'm involved with is state funded, which is actually pass-through money, federal funding, sexual risk absence education funding that the state receives to work with youth through school-based and after-school programs to prevent teen pregnancy and at-risk sexual behaviors. So I work with a team of agents that deliver a program called Relationship Smarts. And so we are implementing that program year-round, and to date we've reached, really, and since we've been doing the program since 2008, we've reached over 15,000 youth, I think, across the program over that period of time. So yeah, so I'm be happy to talk with folks who might be interested in some little, working with, interested in the couples education. We found with that program, we're seeing amazing changes in terms of just couple functioning, individual well-being, parenting, co-parenting. It has quite a spillover when, especially when working with couples who have children, spillover effects on both parenting outcomes and individual health and well-being outcomes as well. Or if you're interested in the work with adolescents that we do around relationships. So. Thanks, Allie.
Awesome. Thanks, Ted. And I have to say, he's got some pretty amazing participant quotes there of people saying that the program literally like saved their marriage. So it's pretty awesome. Well, thank you, Ted. And so next up is Dr. Sarah Hennis, and she is with us today. Sarah.
Hi, thank you, Allie. Hi there, my name is Sarah Hennis, and I am an Extension Nutrition Specialist Assistant Professor here in Department of Nutritional Sciences. And my main role here is the State Coordinator for the UGA FNEP, which is the Expanded Food and Nutrition Education Program. Many of you have probably heard of SNAP-Ed, maybe not so much FNEP, but a fun fact is that FNEP is actually the longest running nutrition education program in the country. It was started in 1969, and it actually has been here through UGA Extension since then, so for about 52 years. To better kind of put in context my role, and what Allie did a great job talking about kind of extension, I manage our programming for FNEP for both adults and youth across the state, and collaborate with Extension in training our county agents who supervise peer educators who deliver the program. What's really cool about FNEP and where it is unique is that we have a peer educator model where those who deliver our series-based programming actually live and serve in the communities that they teach. So that's one of my main roles. In terms of outreach projects and research, currently have a really great collaboration with Morehouse School of Medicine. They are leading a project called Project Dine, Dads in Nutrition Education, and FNEP is the nutrition education intervention in this particular study. I also have collaborated with 4-H with our Food Masters Initiative, which is an NIH Science Education Partnership Award. The Food Master Initiative teaches math and science through food and nutrition. It has several different curricula, and we've partnered with 4-H to adapt curricula and work with middle schoolers in a series-based program as well. In terms of possible opportunities for funding and collaboration, always looking for collaboration with FNEP. You know, what's interesting is that FNEP is a federally funded program. We're actually not allowed to use any of our funding for research. So any research that we do needs to be funded through other program or through other proposals, grants. I'm also looking for opportunities in youth and adolescent community nutrition education. I'm a registered dietitian, and it's one of my passions is also working with youth and families. Thank you so much for the opportunity, Allie.
Thank you, Dr. Hennis. All right, Dr. Turner.
Okay, sorry, I wasn't sure what order you were going in. Hi, everyone. I am working more on not the food nutrition or relationships, but the indoor environmental issues. So I coordinate the program for Georgia for radon, and that's a big issue right now because it's Radon Action Month. But we have a pretty dynamic radon program out of UGA where we do air and water testing as well. And the water testing was actually set up here, and we do the samples at our agriculture lab here. And that project, I'm actually involved with a group in Atlanta who's doing some community-based outreach right now in the Collier Heights area, which is kind of an interesting project. They're partnering with several different people to look at radon and behavioral changes and getting the community to make changes with input from the community-based research. So radon is one area that I've done a lot of different things. We're targeting a particular county now, so that provides an opportunity if someone is interested in working with us on water and radon, and just seeing how much information in one county can make a difference in increasing testing, awareness, and mitigation. And that county is Walton County, which is out here in the Athens area. The other projects that I work a lot on are disaster or emergency management. So at UGA, we're coordinating in some internal things, and we're very tied to the state for responding in emergency situations and for creating resources in emergencies. And that includes and goes over into the food area, in particular for food safety issues and all the questions and things that go along with that. In fact, we just released some new things for the upcoming snowstorm, some social media, things like that. And the other thing is just general indoor environment, which we had a lot of issues and interest in during pandemic because people were spending so much time indoors and they were really interested in what was going on and is an air cleaning and mold and all the different issues that many of you are already aware of. So I'm open to collaboration opportunities. So that's it.
Thank you, Pamela. Dr. Johnson-Lee.
Thanks, Ali. Hello, everyone. I'm Jung-Sun Lee. I'm professor in the Department of Nutritional Sciences and also faculty of gerontology here at UGA. I'm not an extension specialist, but I have been very closely working with extension for my research outreach projects in the past. So my research focuses on hunger and food insecurity and community-based nutrition interventions and policies addressing nutrition health disparities. So I'd like to share some of my current research projects. First one is UGA SNAP-Ed. This is a USDA-funded evidence-based nutrition education obesity prevention intervention for low-income Georgians. And we provide complementary multi-level interventions, including direct education, e-learning, social marketing, and policy systems and environmental change interventions. And we reach and impact around 3 million low-income Georgians a year using multifaceted recruitment and also implementation strategies and nationally recognized research-tested program content, along with the rigorous evaluation. Other projects I'm also have been working on is in partnership with the state agencies to examine the impact of nutrition assistance programs on food insecurity, health outcomes, and healthcare utilization and expenditures among older adults. So this project allow us to establish the first ever statewide longitudinal data set, including almost 40,000 older Georgians to examine the nutrition health issues in vulnerable older Georgian population. And lastly, I have a new project to examine the impact of COVID-19 related food and nutrition assistance programs and policies, starting with in collaboration with the Georgia Food Bank Associations. So some of the possible collaboration opportunity I see related to the development, implementation, and evaluation of nutrition intervention targeted low-income population here in the state and also outside Georgia. So thank you for the opportunity to introduce myself and my research and outreach project.
Thank you so much, Dr. Lee. And she's not an extension specialist, but we sometimes forget that because she's so involved with us in many different ways. And Diane, Dr. Bales.
Hi, everybody. It's good to be with you today. I have a number of different projects that I'm involved in as well. I am an extension human development specialist, so my expertise is child development, birth through adolescence. Dr. Fudris and I work closely together on certain projects. Some of the major efforts that I'm working on, I have a longstanding brain development education initiative. I am not the one doing the neuroscience research, but I am one of the ones trying to get user-friendly kinds of summaries and information about the neuroscience out to parents, early childhood teachers, decision makers, those kinds of things, or those kinds of people. And I'm always looking for, and particularly looking for help and support in terms of how to evaluate these efforts. Because of how we have organized them, we've been very effective in reaching out and made it very, very difficult to evaluate. So I would love any partners that have any ideas for that. I'm also involved in nutrition and physical activity in early childhood. This is a sub-piece of Dr. Lee's SNAP-Ed project that she just talked about, one of the sub-projects where we are implementing some nutrition and physical activity education and some policy systems and environmental change interventions in early childhood classrooms, Head Start, pre-K classrooms around the state. My two newest projects, one is a USDA Rural Health and Safety Education Project around preventing opioid misuse in rural Georgia. And we're working primarily right now in 6 rural counties, doing a wide range of interventions trying to help both increase community awareness of opioids and opioid misuse, prevent opioid misuse as much as possible, and then prepare some community members to help recognize signs of misuse, places to refer people, some of those kinds of efforts. This project includes a youth effort done through 4-H to educate young people and help them be advocates in their community for community-based kinds of changes, such as drug take-back events and community education kinds of efforts that youth can lead. One of the big pieces of this project that's really just getting started is a telehealth component where we are working to pilot using some of our county extension offices as what we're calling hubs for telehealth, telemental health, where community members who may not be comfortable going into a therapist's office or that type of an environment might be more comfortable and more willing to come to the extension office and join their appointments or have their appointments via telehealth. So we're just getting started with that project. It's actually a component of both the Farmer Stress Project and the Opioid Project. And I have already reached out to some people with telehealth expertise, but would love any collaborations around that as well. And then my other project is around farmer stress, which really is tying into some of the rural stress efforts as well, where we are trying to both increase awareness of the stresses that farmers face and provide connections and interventions, connect farmers to interventions that can help them as they're experiencing the stress, and farm families as well, but primarily farmers themselves. So we're doing a number of things, including a retreat for women in agriculture, a farm stress summit. We're working with some School of Social Work students who are going to provide some case management and support for some farmers in some of our communities. We're offering training, primarily mental health first aid, youth mental health first aid, and QPR, suicide prevention training. And one other little piece that I wanted to mention that ties a lot of this together, I am also the director of the Child Life program at UGA. Child Life is a program that prepares child development experts to work with children, youth, and families in hospital and other healthcare settings. And so if there are opportunities for collaboration around hospitals, around social emotional needs of children and families in hospitals, and lots of interconnections with these other projects, I would also be very interested in talking with people about that.
Awesome. Well, thank you so much, Diane. I'm always so impressed by all of the different things that you do. As with all of my colleagues, we get to wear many hats in extension. That's one of the things. We don't get to be super narrow and focused. Sometimes we have to help in any way we're asked. So we have a few extension faculty that were not able to join us today. They're listed on your contact list sheet, and I'm not going to go into detail about each of them, but I did want to just introduce you to them. Courtney Brown is a dietitian and a PhD over in extension in 4-H, excuse me. And Courtney works with several of us on a lot of different projects, but she's definitely our link to youth outreach and nutrition education. Dr. Jermaine Durham is one of our newest faculty. He's an assistant professor and director of the Georgia Initiative for Community Housing. And I'm not going to pretend I know a whole lot about his role, but I know that it is very important for making sure that housing is accessible across the state. And so he has different GIC communities that he works with around the state on residential inequality and housing policy. Dr. Joan Kuntz, I mentioned earlier, she is one of our extension financial planning specialists. She works in a lot of different areas, helping people do everything from their individual tax returns to estate planning to working with millennials on financial management and investment behaviors. And she and I have done a few projects. You might be thinking, well, that's totally separate from health, but we all know that, if you don't have financial wellness, you don't really have any other kind of wellness. And so we've done some work together on health insurance and how that health insurance status and how that may impact health behaviors. Dr. Carla Schwann is our newest extension faculty. She's an extension food safety specialist, and she literally started a couple of weeks ago. So her background is varied, and she's done a lot of international work in reducing foodborne pathogen contamination in informal markets in Cambodia and in Bangladesh. And I know she's going to be doing a lot of work on consumer messaging here. So those are all people that you could potentially also interact with. So before I lead us into discussion, I just want to talk with you about like what our role currently is with Georgia CTSA and how we might work with you as you think about this. I mean, as you can see, we are all involved in our own community-based and translational research projects. So we all have that assignment. Myself and Dr. Allison Penn, who is our Family and Consumer Sciences Program leader, serve on the Community Engagement Program, the committee and the steering board. And in that way, we often serve to help do community capacity building around science and research involvement, but also aid researchers in how they might engage the community, whether that's the extension community, the Archway community, I think I saw Sharon Liggett on here today, or other communities in research. And so we try to enhance those community academic partnerships. And one of the ways we do this in Georgia CTSA community engagement is this 3-tier level of support. So that's something that you might be interested in, whether you're looking to engage extension specifically, or you're looking to just engage the community and you're not really sure about how to go about that. You can actually put in a request to pitch your ideas to our steering board and just get some general feedback. You can get a committee from our community engagement research program to provide more in-depth and regular feedback on your research ideas or your grant proposal you're developing. Or you can actually write the community engagement research program into your grant as your one of your stakeholder advisory boards. So just wanted to remind you of that service, and through that you can access extension if that's sort of the community that makes sense based on your project ideas. And then there's also this community academic database, and I think all of my colleagues and many of our community collaborators have entered in this, where you can identify as a researcher what you're interested in. But also community members can identify what they're looking, topics that are important to their community. And so that's available on our Georgia CTSA website. So I think we'll go ahead and go into discussion, but I think as you think about how to engage with us, I mean, part of this Blue Sky group is to start the relationships that we believe are so important for success and extension and outreach in our community-based research. You know, we work through our extension agents, and those relationships with those extension agents are so important and have to be managed gracefully. And the same thing with our agents in their communities. You know, we want to make sure that communities don't feel overtaxed, but they see the opportunity within research and are treated respectfully and as equal partners as much as possible. So we hope that this kind of a meeting will help you start thinking about maybe how we can work together and help us plan ahead and be sensitive to those community needs. I think we've all been in a position where we've been approached at the nth hour, you know, that there needs to be a community piece, and can extension be that piece? And sometimes, you know, we're happy to do that, especially if it just fits right in. But it's always, you know, better to be on the early side. And so always thinking about, you know, what you can give back to the community in a project as well is really, really important. So I think we will move into our discussion portion, and I'm going to go ahead and end my slideshow so we can see each other. And let's see, Lauren, how many people? We're up to 44 people. So I don't think we'll do like the round robin of introduce yourself and your area, because we would be here all night. We can if nobody wants to talk, but would anybody like to get us started? Any questions that you may have?
Good afternoon. This is Debbie Kibbe with the Georgia Health Policy Center. Allison, I'm curious about the connectedness between the licensed and trained entities that are providing DPP around the state of Georgia, and if there's been any discussions about cross-organization collaboration to really understand the impact of DPP on Georgians.
That is a great question. So I'm in touch with our, the Department of Public Health and Allison Smith there, who oversees the diabetes programs. And actually she, through pass-through funding, has funded some of our extension agents to become lifestyle coaches. And so there has been some discussion about how we might better collaborate, because I think we've found that those who are employed with the Department of Public Health in the local health department offices generally don't have the bandwidth to teach the program, at least on a regular basis. And so, yes, we are definitely exploring the potential for partnership. We are also supporting the diabetes prevention program for University System of Georgia faculty and staff. And so looking at how we can utilize extension to serve all of those campuses across the state, but how that can also be done in collaboration with the local health department. So those are the main ways that we have been talking about this collaboration. I think everybody's been involved in getting their CDC recognition set up, but we recognize that in order to sustain this program, there's going to definitely need to be partnerships. So I would be more than willing to talk with you about that more offline or later in the discussion group.
We've been working with Tanner Health System in West Georgia for some time on their community health needs assessment, and they're a DPP provider. And I'm curious about fidelity of implementation, or these entities being able to share the strategies that they've employed to recruit and retain DPP participants. And so it just might be even a half-day workshop where all the DPP licensed individuals are invited to a single sharing session, peer sharing session.
That sounds wonderful. I would love to talk with you more about that. I'm writing down your information. Yeah, and that's one of the things we're most interested in, is trying to figure out what are the strategies for implementation and fidelity with flexibility, and maintaining that fidelity to the program for sustainability of coaches and participants, right? I mean, it can be a tough program, burdensome to deliver sometimes. And also how we can get better referrals from clinicians to support our participants. Thank you so much, Deborah. Let's see, does anybody else want to speak up?
Hey, Allison, this is Brad Phillips. So at the University of Georgia, and then across the network of our clinical research centers that really are to support investigators to do research, there's always, a consistent demand. So how can we do this project and involve rural communities, or the research is specific to rural communities? And so just kind of wanted to explore that a bit. The challenge is always, we have research nurses that can go into different communities to conduct, studies, but, the outreach piece, doing things by telehealth, is also very exciting. So I'm not quite sure if you can comment, or if it was Dr. Bales, that, the opportunities to collaborate, maybe doing some virtual study visits, or to best engage rural populations, and maybe using some of the telehealth infrastructure that exists through Cooperative Extension.
Thanks so much for that, Dr. Phillips. I am going to ask if Diane, you're willing to chime in a little bit about your experiences so far, and then I can follow up.
Sure, I'll chime in with the kind of the caution that we are at the very, very beginning of this. So we're still learning ourselves. We're still trying to get infrastructure in place. We're trying to talk with communities to get a good sense of what are the barriers, what are the challenges, how will they respond well. But given all of that, I would love to have conversations about how we could make these things happen in more than one project, because it's a lot of legwork and a lot of effort for one short-term project.
Yeah. And so, Diane, I think that, nationally there's a push to use more virtual meetings. Is related to research, doing research study visits virtually or remotely. And so I think, you know, if we can try to harness and partner in that, there will be lots of opportunities to support, you know, a number of researchers that do want to do these studies that are in rural communities.
I love it. And a lot of the information that I have collected so far has been more clinical kinds of visits and how to, how to maintain HIPAA, compliance and some of those kinds of things and what are our responsibilities versus a provider's responsibility. And some of that'll look similar for research. Some of it'll look different.
Yeah. And well, just my other question, and there's the focus of the Georgia CTSA is going to be on health equity, and within that maternal health. So maybe just some discussion or some comments on what the opportunities might be for kind of maternal health. I mean, I know nutrition is a big part of that, but opportunities to partner and look at other kind of health outcomes or interventions for that specific population in rural areas of Georgia.
Yeah, so this is really a very interesting topic, and we've waxed and waned over the years about our level of programming related to maternal health, and so we've been exploring the last couple of years with other CTSA investigators some different ideas for how to maybe support education around postpartum blood pressure management, looking for warning signs. And so we're still in the infancy of trying to figure out what that would look like, but I think there's a lot of opportunities to collaborate with clinics and researchers to do some of that, remote monitoring and signaling for when there's concerning issues, and then extension may be able to do the educational piece of that, working with individual moms or groups of moms to understand what they should be looking for. I also have on here, Dr. Hennis is with me, and she, I don't know, Sarah, if you're able to comment too, just on FNEP and the role that FNEP has had in serving pregnant moms in the past. And Sarah may have had to step away. I don't want to put you on the spot.
Hi. Yeah, so FNEP is specifically designed for limited resource families, so caregivers with children and pregnant moms and pregnant teens. And previously, a while ago, before I came on board, so back in mid 2000s, there was actually an FNEP, a UGA FNEP curriculum for pregnant teens. And I'm currently have a graduate student who's interested in maternal health, and we are beginning to look at the potential for bringing this back and serving this population. And so that's something that, that's specific actually for the FNEP population, and used to be a more focused curricula here at UGA FNEP. And we're exploring the potential for that, in the future. Did I answer questions?
That's perfect. Yeah, it sounds like opportunities for collaboration for sure.
I'm looking to see if Dr. Sina Gallo is still on here as well, as she's been talking with us about.
Allison. Hi, everyone.
You there? Hi.
Yes, this is my area of interest. I recently, over a year ago, joined the University of Georgia. I'm a nutrition faculty. I'm also a registered dietitian, and my interest is really in pregnancy and in postpartum maternal and infant health. So looking at breastfeeding promotion, I don't think there's anyone doing some of that work in extension right now, and that may be a need. So that is within my area of interest. And if anyone is interested, I'm not extension faculty. I did see a question, and if no one has a follow-up to that, about about grant funding, and I thought that was really what I was thinking about as well. How do you write extension into the grants? I was hoping you would be able to address that, because I think that's one of the issues with us researchers. What does this actually look like on a grant application?
Ed, I see you unmuted. You want to?
Yeah. My first advice to folks who haven't worked with extension before is connect with them before you do. Connect with I mean, like you would anyone, right? But also you build in ample time, right? So I know a lot of times with grants, there's a quick turnaround. Often, you find something, it's like, oh, 2 months later, got to submit a grant proposal. I think the sooner you can reach out to the right, I would recommend start with the extension specialist, start with kind of our team in the appropriate area. Reach out to us first as kind of a helpful gateway into our extension networks, and briefly describing what it is you're hoping to do, what you're looking for, what the expectations are. Maybe go ahead and offer some dates for maybe like a Zoom meeting with agents who might be interested so they can hear more. And then we can get the word out to our agents to see who might be interested. And then build in ample time to engage agents to collect more, to collect information about what their capacity is, what they can do. There's a whole hidden system of how processes of how things work. I mean, in terms of agents getting approval. So none of the agents, just so you know, in a county would automatically be able to say, yes, sign me up, I want to be part of your grant. That won't ever happen. They've got a kind of a chain of command to kind of go through that has to provide that approval from the county level to the district level to the state level. So that's why I'm saying you've got to really build in ample time for that. And then there's discussion of what the funding looks like, how the funding will get processed. But when it comes to describing extension, if you got one of the extension specialists working with you on this, they'll, I'm sure they'll be glad to help you with writing that part. But I think the writing is honestly going to be the easiest part. The hardest part is the timing and pulling together the agents and the counties and getting the information and making it very clear to the agents what it is you're trying to accomplish, why it's of value to their county, to their stakeholders, because they've got to convince their stakeholders to be involved, and kind of and making it very clear what their role is, what the expectation is.
Yeah, so I think just to follow up on that, our extension agents are very eager to participate in lots of different projects, but just like you and I, they have a lot on their plate. And so, and because they are part of the university system, they get to enjoy a little bit of that red tape too. So, there are some approval processes that would have to go on. So I think that's our point in just saying as early on as you can. I think Ted makes a great point about, this is a great way for us to start to get to know you all, for us to start those conversations. I think, Dr. Gallo shared about her interest in the breastfeeding, and granted she is in our department, but the way we've started our conversation was, she came to a few of us as extension specialists. We kind of talked about her ideas. We said, why don't you come to this next faculty meeting and share this information with the rest of the group? And then now we're going to kind of work through the channels to see who might be interested in being involved and what communities we might tap. We do have some community-based coalitions that have evolved out of some different projects. And then there have been some issue-based coalitions that have been around for a long time. And we are trying to develop those out more so that when, for many reasons, but one of the reasons being, if a researcher comes with a particular topic that they might be interested in, we could say this community through their own coalition work has been interested in that topic. Like, let's go there first. So that is in progress. But extension also has natural systems of extension, local extension leadership teams and groups that they work with to do that needs assessment and understand what their communities are interested in. And that information is fed back up through several different levels. So we would have a little bit of a pulse on interest level around the state. So like if you were interested in a particular rural area, coming through us and with the rest of our very large network, we can kind of help navigate that.
Got a couple of questions. Yared Alamu, I'm founder and CEO of TQ Intelligence. We're at the Advanced Technology Development Center at Georgia Tech. Have you worked with startups before? And then the second one is any project as relates to mental health.
So I personally have not worked with startup company. Well, I worked with one in previous life, but not specifically through the extension system. I don't know if anybody else.
Think, Allie, I would think maybe some of our College of the Ag folks, some of our ag agents probably would have some experience in that, because if you think a lot of our ag researchers are studying cutting edge, innovations in terms of, way to grow crops safely and whatnot. So they're testing products. So they are working with a lot of industry. So they probably have a lot more experience with that sort of thing with startups than we do in more of the social science area.
I know Joan's done a little bit of work with the small business development innovation.
Maybe, yeah.
As well. But I think you said also, mental health. So that would definitely be Diane and
Yeah, I mean, we're focusing on mental health and have pilots in rural Georgia, and we're exclusively focusing on, kids from low-income communities. So that was my question: is it so we, we already in some of these communities, and we have nothing in common with ag. We're primarily focusing on child and adolescent pediatric trauma.
Somebody wasn't working. You also focus on IMDb.
I have a question. I'm very from UC Thursday. Are your choices on the oral study session? Wondering if you all have any researchers who are working on oral health mission graduate.
I'm not doing that, but, what is it all?
Well, I'm listening to the behavioral connection between oral health and other systems, but I'm particularly focused on maternal populations and looking at ways to reach out to communities, maternal communities, to look at what the challenges are that they have about accessing oral health care. And I know that's an issue, particularly in rural communities. So yeah, any resources that you might have in that direction.
I don't know if anyone's actually said that, but I think it's worth it. There are certain counties, are really wanting to target for research. Like a county has really high rates of such, and that's a county you really include in your sampling of your study. Then I think trying to the extension agents and county to see what opportunities, what might be to go forward with networks, or see like what service, what the agents identify other partners to with get word out. A lot of information is very good with partnership. I'm familiar with partnerships. Partnerships in Google and every county has they don't have their name in any county, but the partnership leaders county did always like bring agencies close together to identify some issues, extensions often that as well, and how easy to handle community issues together in the county. So that's also a good network to connect to if you're trying to find some partners for your recruiting participants or especially getting educational information out.
You're also open to working with, I also work with Health College of Georgia, and we're also working on trying to get the word out and working with stakeholders in different parts of Georgia. So is that for you all open to working with community organizations?
Oh yeah, I believe we do. I know we're in Georgia, I know Diane works with that too, and a lot of things. So all specialists here are involved in some sort of state level organization in our programs.
Thank you.
And just to follow up on some of your points about organizations, I only already been in some county organizations as a relation to the and like they said, they do and so in that area, people are doing here's what you're to have outreach and all the to access meaningful posters. And the agents are really wanting to do that. So like I said, that's why you start with us, and then we have a colleague who needs this there. So we have a connection to communities.
Got it. Thank you very much.
As a company, because when we're right around me and I went to teachers and not teachers. Oh, match article. Just really excited. So that matches was just and you're the piece on the working on the coalition. We're going to talk about issues of coalition and not necessarily coalition. There's already existing one that are very particularly involved with stakeholders. People use that those types of collaborations. But I'm going to decide from mental health and movement. You're already doing.
I think it's interesting. It's not necessary.
I'm kind of considering visual lesson progress on what else you are doing outside of interviews. Research and application of projects with finance and nutrition. Are there other networks or doesn't take through intervention systems to extension?
Just not about user thing. That's the approach I have to use.
Go ahead, sure, extension.
Yeah, even if you use the agent here, there's an that we're decision for order and agent place and ultimately, but we have not had a situation last couple years or an extension. We'll go back with political technology so.
And I'll just add that we have a building we had in my class today is on city checklist and some Brian working on Flip. They're working on these issues. So we can that, but they do a lot of programs. It's centers, they do. And we used to have a mortgage program we do now. We have more seasonal tourists in there. Not even since that doesn't the older researcher with extension actors on
My research programs focusing aging related to this agency to major services to the and major services kind of organized across state under 12 program services. So we call commissions. So I work with them and I guess it's not true extension for me right now, but I work with them. But if you plan to connect to any other, might be able to provide more information.
Are there any other questions that folks said for all this extension part of the state organizations? I think I'm not sure that we've done that, but absolutely we've been here for a while now. So we're looking for one extension. I was going to say we're not doing that, but we are in this. So So our students do a lot of their senior governments, we do a lot of programs, we have to bring forward the association of governments to develop some employees, and now we're working with the governments and not on events, business activity environments, and government activities that often deals with policy and buildings and building various senior governments around that work. That's my front of those working ways to governments. You know, business do government very closely with government. Now, I know too much about them, but you're not working today. Seeing how you do a lot of different projects, doing that studies, doing their work. Other business do really check that as well.
And Dr. Brown, he had a topic we call the internship community. There's really coalitions of the community for creative work by housing issue that he emphasizes is important, and they want to emphasize sports on it. But that's a good way to connect with other government, city, county, leaders, and administrators, and community. So that could be a good way to connect and to the community as well.
Sure, they want to hear this today. Jeremy, I was trying to highlight, but thanks, this is a great presentation, we're just giving me stuff. And so our partnership, we are in 8 counties around state government, and we connect local identified challenges back here to the university or faculty site, we connect with all universities, give us higher education resources, whether it be student learning or faculty research projects, and tie them back to those community and so we have built some great partnerships with CSA in the last 4 years, and we're looking forward to this is a renewal of the CSA that we can continue those collaborations. We've done everything from health, wellness, education, a ton of public health, and we also connect to all 17 colleges and schools here at the university. So it can be anything from engineering to medicine to graphic design, and all the schools. So we always welcome opportunity to partner and to really spread the knowledge about health across the state. So thanks. I think that was virtual. All the best. First thing and at a local level, our business professionals work very closely together. Several of the projects are, I would consider the network that we're working on, big issues, they call them, and attack them, and resources can use, promote health well-being and network security as well. Can I say specifically, this is not also on city council in Carson, and we have, on our money, we have to figure out what is the most impactful individual way to spend, and we have more distance, disability assistance, we have various one of the things that we were talking about is creating a mental health resource, and rather than a very small town, any town with average household income of $30,000, which is like way below Georgia average. So we probably would be able to just like bring on higher social workers, and I was trying to think of a way to sort of do mental health kind of thing and set up partnerships with mental health professionals possibly in other states, but I was just wondering if you guys were aware of programs like that you might be able to connect with. So I feel like I'm probably trying to that the programs must have been done because bigger cities have it, we're just very small. Anybody? Diana, so you want to talk about how you're next to the over to be able to see yeah, I'm not sure what more is supposed to be said. Yeah, I'm not sure. I think I'm right here in the other trade and social work needs access to care and services is what challenge so many of our especially in the organization for services that customer updates or maybe just with our often visually and so we know from other years that's to having systems as well for super come to the job and work out what we want to do rather and one more in access to commercial and zero. Any other questions or comments?
So I think that's obviously all the research, that really well have on UGC for do extension also program. But we might CSA doing sort of higher income score. We want all other people. So and we have people to show CSA. So we're going to be able to work to get more of my social building and grasping ideas on social and then was and what we have big experience so just on needs always and problems and for weapons and how you have to get me anybody is to get back to like figuring out so not just that you know very very important so that we can really have the right communities to be take time also that we're very basically doing that kind of project that was very well to plan also you know the project teachers are so that we're really going to do the training show and everything to that given the all the sciences all years organizations like here it's the body is well for recent others. So I would say we'll once I talk in the chat we are all information these are the reach out to everybody we're going to talk about projects companies and we want to reach you so we're looking for those opportunities for resources to companies and really issues that us companies and people know that it's really like so you want to after we put it in the idea to your layer and there are community that so I have to be so that is not the end of our relationship with you and the reason that's one and say but what about yourself?